If doctors save the patients, physiotherapists make it worth living. So if you also abide by the same and if you follow the same, you have come to the right place. So hello and welcome. This is Himanshi Kaushik, your host of the day, and I would like to welcome you all in today's webinar on physiotherapy profession, past, present, and future. And I hope that you're all safe, sound, happy, and healthy at wherever you're taking this webinar from. So before we move on and learn a lot more about the session, that is the physiotherapy and the profession and its history, its maybe the future, we have our expert here with us today. So I shall introduce you to our expert. We have Dr. Zaki Anwar, Professor, School of Allied Medical Sciences, Lovely Professional University, here with us. He is an experienced individual with over 16 years of academics and 6 years of clinical experience in India and abroad as well. He has done his master's in physiotherapy from HNB Garhwal University, Uttarakhand, and since then he has published more than 14 articles in international journals and has attended 8 conferences and seminars and presented 6 papers in different journals of repute. He has got several awards like Best Academician Award, and he is a lifetime member of Indian Association of Physiotherapy and Maharashtra OT and Physiotherapy Council, Mumbai. So, sir, it is a pleasure for us to be here to be able to listen you in the webinar. And I heartily and sincerely welcome you in the webinar, sir.
Yeah, thank you very much, Usmani. Yeah, I would like to. Yeah.
Sir, just last second, and before I request you to carry on with the session, I would like all the participants to know that now you can post in your queries in chat box, Q&A box, or you can raise your hands with the questions so that we can allow you to have a chat session with our expert here. And with this, sir, I request you to please take over the screen and looking forward for an amazing session.
Yeah, fine. Very good afternoon to everyone. Myself, Dr. Zaki Anwar, working as a professor, Lovely Professional University, School of Allied Medical Sciences. Here we inculcate not only as a profession, we inculcate budding students who come in, they landed up with which is a small mud of areas where we can inculcate, we can module them in a shape of a budding future of India. So here we can introduce as a Lovely Professional University, the Department of Physiotherapy. We have got many things, achievements came when physiotherapy initially introduced in India way back in 1952. When the initially nobody knows about the physiotherapy profession in worldwide. Here we have introduced a physiotherapy profession by 3 of the nursing staff in particular areas of the nursing care. The areas came when there is a lot of disabled patients came after World War I. So looking into the aspects of the rehabilitation of those patients who got injured in World War I, it is a big challenge for the Western world, including those third world countries whose soldiers got injured, whose nationality got injured, whose citizens got injured. So those rehabilitation protocols came into existence, and these with the particular sets of the knowledge which has to be inculcated, the draft has to become so that in the whole sets of the disabled people or the dysfunction people is set patterns came into the government's picture. So these 3 nursing staff in London, he has inculcated and drafted a theory and which has initially came into existence. And here the particular physiotherapy profession came into a picture where a physiotherapy is one of the most popular known form of therapy that helps a patient rehabilitate from illness or disability of its kind. So this is the term picture came into existence after the First World War. So initially it specially provides a primary initiatives care, making use of certain movements, mechanical forces, which is going to mobilize the affected area of the joint. Suppose in the World War I, some people lost their lower limb. Several people have lost their upper limbs. Either the single side of the upper limb lost, either the both side of the upper limb lost, and the lower limb as well. So those amputation, after the amputation, they have got a lot of sets of the particular agonies are there, psychological impacts are there in the general society. So to overcome that, lot of psychologists and physiotherapists as a team member, they work together for the rehabilitation of those got disabled. So that after getting into picture, so physiotherapy played an important role, not only increasing the mobility and motor functions, also reduces the impairments and to improve the overall quality of the life. Suppose in day-to-day life, we often talks about in your society, some people have fallen ill and they have got sets of the stroke. They have got sets of the other disabled like hemiplegia, paraplegia, fall from a height, they met into the spinal fractures. So those conditions of all the sets of the patterns of the musculoskeletal, including the neuro patients, come into the purview of the physiotherapy team, where normal medicines and only the surgery doesn't help the patient to come back to the activity of daily living. So here a physiotherapy plays a key role. So you being one of the key important factors, key important players in that particular profession that you have to play as a role and role model to rehabilitate those patients back to their life. So we'll talk more on the particular sets of the how of physiotherapy in India got originated. So way back when Shishuta techniques is one of the important, he was a sets of the known Indian physician who had drafted a concept of the breathing and physical exercises in the main population way back in 600 BC. So he was the main factor who has developed the discipline of medicine in India and encourages aspects of the different breathing pattern has to be taught. Their therapy has to be inculcated, including usage of the water therapy, different techniques of the stretchings and all, so that our proper sovereign physiotherapy patients get well soon with the breathing disorders. Coming back with one of the more aspects of the particular sets of the physiotherapy, which is preceded dating back almost not only with the world, we are racing with the patterns with other first world country as well. So it is the influence and the knowledge which we have spreaded worldwide, and we have developed a different sets of the pattern along with the Western world countries. And our physios is getting graduated from India. They are with at par with the particular other particular disciplines or the universities who is teaching these professions worldwide. So our curriculum are at par or even matching with the standards of the international standards. So in the particular sets patterns of the physiotherapy in modern India, we have seen that there is sets long back years of 65, which we have dedicated in a medical professions, which was started in 1952 in the sets of the outbreak of polio in Mumbai. So very next year, sets of the patterns of the support of the government, support by the World Health Organization, and the particular concept came into India. We have drafted a first institute in Mumbai. So after registering the particular sets of the pattern, we have find a lot of other gap periods in the particular sets of the physiotherapy profession. So we have started increasing number of the other national institutes, which are not much in number. They have got 5 of the national institutes. The majors are situated in the big metros. So other cities of the India, the other national institutes are not quietly there. So other key players like private key players, the other government state body players, they have devised sets of the department and the particular curriculum they have got inducted in the state universities. So in this way, our physiotherapy education inculcated in India, where an Indian Association of Physiotherapists has registered, which was set up in 1962, total of 30,000 registered physiotherapists, which was an earlier data we are having. So coming back with the other sets patterns of the particular factor, we have also accepted and an importance has been given to the system of medicine, where we play a key role along with the orthosurgeons, we play a key role along with the cardiologists, we play a key role along with the other sports rehab manuals or sports medicine physicians who, after manipulation of the particular ligaments, tendon injuries, we facilitate those events after the injury or the collagen formation in the ligaments and joints. We facilitate those movements so that the particular athlete will come back to the particular normal sets of the moment, or they can rejoin the sports after the injury rehabilitation. So here we can easily find other sets of the patterns of the patients or the particular sets of the individuals who fall sick. As we know, in India, we usually often come across several sets of arthritis, swollen shoulder, dizziness, vertigo, backache, headaches, sciatica disorders in aging population, including the middle-aged citizens as well. So we play a key role in the particular general population, where we will find the particular sets of the treatment, and we follow the as well other sets of the treatment, and followed by the sets of the other protocol and the events area, where we will find it very difficult to manage. We will facilitate those patients, we give counselings, we rehabilitate those patients to the back to the normal life. So coming to the other sets of the treatment, in future aspects of the physiotherapy we'll talk of. With the advent of more and more skilled techniques and state-of-art equipments, physiotherapists can easily serve the particular patients better in each days. As we know, we are treating lots sets of the diabetes, sets of the arthritis, cancer, and cardiovascular rehab protocol patients who are in ailing disorders. So coming to the very hustle and bustle of the everyday life, we always often to take a different sets of the bodies and the physiotherapy treatment, where we take an curative measures, we'll take in curative medicine measures far cheaper as compared to the other advanced measures. Suppose we came to across a different sets of the treatment where it is not been working out, a particular sets of the treatment where it is been facilitated by the medicine expert, by the surgeon. So we, along with the co-companion with the other team member, we also play a key important role in getting back the patient from the hospital care IPD management back to their home in a faster manner. So during hospitalization also, we physiotherapists play a key role in the hospital care as well. So nowadays, NCHP Council, which came into existence in 2021, they have facilitated, given more powers to physiotherapists. So they perform better. We'll get a lot of accreditation from the government, and we play a key important role in the government as well as in the private setups care. So as talked about the BPT, Bachelor of Physiotherapy, it is 4.5-year curriculum. It is in the regular mode, passing 60% with the aggregate marks. Rest our team of the LPU admission team, you can have a word with. They can give you a better other aspects of the qualifying criteria, so you can easily enroll with our curriculum at LPU. So here we focus more on the different specialization as well. Other specialization after BPT you can do is pediatrics, obstetric and physiotherapy, sports physiotherapy, neurology physiotherapy. These are master programs, including orthopedic physiotherapy, geriatric, post-operative physiotherapy care, which is in the general mode. Coming to the other aspects like most advanced, cardiovascular ICU management. There also, after the COVID-19, physiotherapists played a key role in pulmonary and cardiac care as well, where we have minimized the death rate of the patients in COVID admissions during the COVID scenario, which the whole world has faced. So WHO has also accepted physiotherapy plays a key role in the COVID management, which the whole world has faced. In India as well, we played a key role in the physiotherapy care advances in pulmonary and respiratory care. So in this respiratory and pulmonary care, physiotherapy advancement techniques has led the patient back to their life after post-COVID syndrome. After this, the specialization, you can also intervene, or you can also venture out with a PhD in physiotherapy, depending upon the specialization you have did after the bachelor program. So after bachelor program, you did with the orthopedic physiotherapy. आपने अगर ऑर्थो विशेषज्ञ से साथ में काम किया है, आपको रुचि उसमें लग रही है कि नहीं, we are more emphasizing, I am more research oriented and I can give more to the research part. So you can come down in the PhD in physiotherapy, where you can use an intervening techniques of the evidences, practices which is used worldwide to give more better care to the patients, to give more output to the research in our day-to-day lives. So coming to the what are the roles and responsibility of physiotherapists play in healthcare sector. Here, a physiotherapist plays a major role in cases of the remedial exercises, muscle evaluation, and particular quantification. Here we used to evaluate the muscle which is coming into hypotonia level after the post disease syndrome. Suppose somebody has suffered from any neuro disease, so his muscles of the upper limb, lower limb get affected. So here physiotherapy plays an important role, where other branches of the discipline also facilitate the patient to come back to their activity of daily living. Here majorly we use other gadgets like shoulder diathermy, ultrasound therapy, articular packs, laser therapies, transelectrical muscle stimulations, infrared therapy, ultraviolet therapy. These are the etc. Some of the known gadgets. We have got other ample amount of gadget as well, which we are seeing in cases of the orthopedic care, including neuro rehab. There is one technique after the neuro balance coordination problems. We use balance platform as a post evidences and the care management in the neuro rehab. Here we can train the patients after the balance in coordination problems. The balance platforms are used, so we can increase the betterment in their balance pattern after neurological diseases. After this, we are using more of the sets of the patterns of the special exercises and special patterns technique like manipulation therapy, mobilizations, and wheelchair and gait training to rehabilitate those cases of the mobility aids we are using to increase the rehab patterns of the patients. Aids in home evaluation, these are the other techniques we are using to increase the healthy environment of the home of the particular patient, so that patient can easily back to their life. So coming improvement to the patients in the cardiovascular dysfunction, we have already discussed lot many care in the IPD and OPD setups during the pulmonary and cardiac rehab. So these are the advancement. Further career options we have with the physiotherapy. You become a consultant physiotherapist in multi-speciality hospital, or you can also join as an NGO in different setups. You can also join as a corporate physiotherapist in MNCs, healthcare physiotherapist in modern gymnasium, ergonomic care advisor. These are the new budding branches worldwide. Ergonomic care advisor. Physiotherapists in special schools can also be enrolled, and their special post has been created for the particular children team. Followed by that, we have also played a role in long term in worldwide like old age residential home, where physiotherapist plays an important role in geriatric rehabilitation, old age care rehab. Sports physiotherapy also is one of the key component I already discussed in master program. You can use these techniques, or you can use those physiotherapy techniques to rehab the particular sports injury patients. Those sports injured patients especially have an affectionate, have an one-to-one care by the therapist, including their guidance to the coaches from which particular sports field they belong. Coming to the entrepreneurship, you can also open up your own centers within any own organization, and it is a registered government body self-practicing organization where you can self-practice without any referrals. This has been guided by NCHP Council, which came into existence in 2021. They have given full rights to a physiotherapist to work independently, open your own entrepreneurship, own centers, associate with any organization with full rights. So here, other sets like you can also open a private practicing clinics nearby. You can inculcate a particular your expertise to the society, opening the areas in the corporate setup area or either in the residential areas as well. And as a physiotherapist, you can also take a space in and around a hospital where it is a running multi-speciality hospital, where you can get easily referrals from the particular other specialty who are treating the patient in surgical and medical care. And you can also become a clinical researcher after becoming a PhD in physiotherapy. So coming to the other highlights of the physiotherapy in our department, Lovely Professional University, we are running 3 different sets of the program. One is the bachelor program, which I have already told you, 4.5 year. We have a master program in MPT, orthopedics, neurology, sports, and cardiac. As I've already emphasized, neuro and cardio has played a much important role after the COVID symptoms. So now the accessibility or the particular sets of the role of the physiotherapist care, their belongingness to the society, their role to the particular population or the country has increased. So it increases a lot much requirements of physiotherapies in India as well as world as well. So after doing a PhD in physiotherapy in this following 4 disciplines, you can further progress to the evidence-based practice, or as a researcher, you can also become a PhD guide in the future years if you complete this PhD program running under our curriculum. We have got other sets of the diverse set of students from the all over the world, where we have maximum contribution from the country of Zambia, Nepal, Bangladesh, and other countries as well. We have contributed sets of the international students who are studying under the banner of LPU in our School of Physiotherapy. We have a noted alumni who have played a role as a physiotherapist. His name is Ishan Barwa. For Golden Boy, Mr. Neeraj Chopra, he played with him. He contributed as a sports physiotherapist when he went for the game. Amreen Hayat, who facilitated as our alumni in Asian Championship in 2022. The other is Vikas Gautam, who he worked as a sports physiotherapist, Commonwealth Games 2022. One is Shobhan Babu, who has contributed as a sports physiotherapist, national boxing team, men's junior youth in 2021. Coming to the other sets of the noted alumni, he has been observed with the World Health Organization, Dr. Firoz, Kamaldeep Singh, who is working with NHS, Shurbi Bhargava is working with Dignity Health, and Amit Chaturvedi is working with Fisher Pile Healthcare Services. These are the noted alumni who has been contributed. We have got noteworthy placement as well. Jocelyn TJ, she is contributing with a Wildlife Sciences India. She was recruited over there. Then Ovijit Vaidya, he is working with Handicap International Federation. Jasjot Singh is working with St. Francis Medical Center, USA. Purnima Biswal she is working with Fortis Hospital Limited, Mohali. These is our other industrial tie-ups and clinical training setup. We have 3 LPU OPDs, 7 hospitals in Phagwara, with 18 hospitals in Jalandhar. Total, we have 26 hospitals. Along with that, we have got tie-up with other hospitals as well in other cities, where we are facilitating in sets of the internship transfer, where the students belong to different parts of the India. They get accommodated with the internship with the different hospitals, which is of 6-month duration after the 4-year curriculum. We have noted under different innovation technology. Here we are using different sets of the innovative technique to develop a gadgets, which is one of the known gadget is GTrack, GT Walk. We are using this to initiate, or we have innovated this technique first time in the world. We can track these events of the different sets, gait patterns of the patient. This is our sole prototype being registered with lovely professional university. We have got industry tie-up with Coopers. We have got other excellence forum where we are training different students with workshops for special techniques, and even we are inviting other speakers from worldwide to speak as well. We have got other best practices technique. We are contributing to the society. We are conducting the healthcare camps with the different setups, so we can contribute as a physiotherapy camp to deliver a good service to the community. And these are keynote industry speakers. We are inviting those speakers, national or international, to speak about. One of the keynoted person is Dr. Ani Irani. Is very famous person among India, who has also played a role as a sports physiotherapist when Indian cricket team was initially played. Dr. Harpreet Singh and other keynoted speakers from the other industries we are inviting. We have got 271 Scopus publications. We have got 386 Scopus Web of Science citation. We have got 41 IPR published. We have 9 IPR granted. We have funded projects of 913.8 lakhs funded projects we are running right now. And other tie-ups are in keynote pipeline. We are associating with different government organizations for the further tie-ups and funded projects. These are the key government and the bodies worldwide where we are associated with it. We are associated with the Edu Labs, ISBR, we are associated with the Ministry of Nicosia, we are associated with other sets patterns. And right now we are running a mobility under the Erasmus projects, where we are contributing a sets of the funded projects being under European Union, where we have contributed. We have set up a gate lab with Erasmus funds and we are initiating the keynote evidence-based practice in gait analysis and management in sports rehab care, including musculoskeletal dysfunction. Followed by that, we have other facilities in the equipments. We have world-class rich equipments in our campus, where we can initiate those students getting particular effective curriculum related with the year. These equipments has been involved in the teaching curriculum. We have got these gate labs, Balance and Gate Lab. We have got ELISA Reader. We have got other institutions which are in collaborations for the research, where one among them are the University de Lozania, University of Nicosia, and other sets of the Indian universities which are associated with our research and innovation program. One of the leading sets of the hospital, which I have already discussed, we have got training placement with the Apex and other sets of the hospitals in and around Jalandhar and part of Phagwara as well. Followed by extension activity, we have got outreach and extension activity outside the campus, where we go, we encourage or we spell out the particular sets of the usage of the best trees, environment protection, biodiversity, those sets of the speaking programs we organize, and we the particular society the importance of the environment and the health factors which has to improve in our India. And we also organize medical camps to improve the accessibility to each people who live far apart from the bigger cities or outreach from the bigger cities. We also organize faculty ergonomics awareness training program, which facilitates other department faculty for what is the best ergonomic sitting chair patterns, use of the best patterns while using the laptop, while using the workstations. We are also inculcating different women health camps, where we are educating different set patterns of the women for better women's health care in our society. We also organize World Physiotherapy Day in our campus, so that it can facilitate the knowledge of the physiotherapy which is being assimilated from the WHO. We have got various sets of the advanced technique of the teaching and learning. We have got 14 ICT enabled classrooms and seminars hall. We have got well-equipped libraries of 14 plus and funded projects 3, as I have already discussed. This is the gait patterns, spirometry, and other cardiac stress test patterns which we are using in the lab for advanced physiotherapy analysis. We have got academic and research resources in our campuses, where we are encouraging students to go ahead and treat those patients with the particular innovative techniques. Teaching and learning facility, we always encourage not only from the sets of the teaching with the initial hands-on technique on the particular bone, but also with the diagnosis of the surface landmarks of the particular patient who is suffering from the sets of the disease. These are the certain sets of the different equipments which we are using in our labs. We have well-established hematology, biochemistry, macrobiology, histopathology, and other lab as well. There, in physiotherapy services, we use in sets of the doubly campus OPD. We have Phagwara campus, we have got Jalandhar OPD, along with the other tie-up which I have already discussed. We have RFID integrations with the different sets of the other organizations, central library, and other setup, where we are using e-resource material for our researches. And these are free of cost, is being provided by the university, and it is being embedded and solely owned by the lovely professional university. We have a tie-up with the databases and e-resource material with JGate, Embase, Spinger, Abisco, World eBooks, Delnet, MapMyAccess. These are the various several platforms where we are using e-resource for the researches in 4th year for our MPT students, including PhD scholars as well. Guest lectures, we have got few pictures along with that. We have got other sets of the program which we have already run. One sets are the pilots training. These are advanced training which we have already conducted, and we are near future also we are conducting lots sets of the workshops from the different keynote speaker which I have already discussed. Coming to the other sets of the patterns, here I would like to hand over the particular mic to Ms. Himanshi, and she can give, if any of the body have got some questionnaire in the forum, they can speak on. Over to Ms. Himanshi.
Thank you, sir. First of all, before we go to the questionnaires that our registrants had sent to us, I would like to extend my thanks to you for coming in, sir, for giving in your
Yeah,
time,
thank you
crediting your
very much.
time and
Yeah.
experience and knowledge to us, to all the participants. And I hope that, like I was enjoying the session, I hope all the participants also enjoyed the session. Yes, sir, we have a few questions. So
Yeah.
this question came from Viraha Sharma. And
Uh-huh.
it says, are there any companies also that hire physiotherapists other than the hospitals?
Yeah, there are other companies which you can even work with. Nowadays, this drug interventions. The drug intervention is being trial on the different patients. Suppose new drug is coming to India with under banner of some of the companies. So those drugs has to be get tried and under supervision of certain experts which belongs to the medical stream. In those medical stream, it comprises of the dental surgeons, it comprises of the physiotherapists, including pharmacists. They have got wide amount of the recruitment worldwide in India. As you know, even US imports most of the drugs sold from India to the different US import companies, and those drugs trials are being done in India, different pharma companies. And at Pfizer, you know, Pfizer is the only company who has transported drug of COVID with the name of Covaxin worldwide, and our pharma companies also recruit physiotherapists for the particular sets of the drug trial as well.
Yeah, and thank you, sir. And I totally agree that after doing physiotherapy, it's not just the hospitals
No,
that you
no,
can go
we
in.
no have no boundaries.
Yes, and you can come in here as in you can teach students, you can be a mentor, or
Yeah,
you can go to different companies, organizations, and help them.
yeah.
And sir, we have another question. It is from Radha Sharma, and it says,
Mhm.
how does WHO approve of anything, and what are the measures, and how can we go in WHO?
Okay, fine. That's a pretty good question. To qualify for a WHO, you must be at least some expertise after BPT. Some expertise, some skill you must have. Either you can do a minor in some psychology, either you can go for an MPT in neuro rehab or orthopedic rehab or cardio rehab. Then you can easily apply and WHO will facilitate. In other third world countries, a WHO runs a different a public health program in which a physiotherapist also play a key team role player. As I have told you, have also introduced, I worked with Ministry of Health in Saudi Arabia. There, the different disabled patients of the particular Gulf countries, they get one primary center to the other tertiary center to the other bigger hospital, where there is a wide gap of physiotherapists in international setup of the hospital as well. I usually way back in India because of the family terms. I came back, but I was serving as a permanent member, as a team player, special physiotherapist to the Ministry of Health Hospital in Riyadh, where the lot of vacancies were there. Even the administrator of the hospital, they asked me, do you know from your cities, from Delhi or somewhere, that they can join our team because we need physios from India as one of the team member to rehabilitate the disabled care people of the countries.
Yeah. And sir, I think I can just say one thing. You attendees, participants, you can come in here. You can get the experience, knowledge from our esteemed expert here. And then, of course, I mean, you can use some of the contacts also. So why not? You can come in.
We also facilitate the induction, the recognition program from to get introduced with the NHS services in UK. We complete their documentation. We complete the Canadian documentation as well. We facilitate documentation and the credential patterns of the people who want to work in USA as well. And we come under executive class A category to get easily H1B visa for USA immigration and as well as Canadian immigration. We come under NCAP, their essential quality of the provinces in Canada, where we as a physio play important role and we get easily got the particular skill set immigration patterns as a physio much more better than other professions where we play important role.
Yeah, definitely, sir. And now, since the world is so developing with the
Yeah,
technologies, we do need physios every other day because we are having so much of problems in our physical health.
yeah.
So I think, sir, we're done with the questions. And at last, I would just want to, take a few admission queries.
Yeah.
So can I show them a little about the site and how the admission process?
Sure. Please
Oh,
continue.
okay. So to all the admission queries, who just want to know how you can take admission, just a minute. Yeah. So I will be sharing my screen. I hope my screen is visible to everyone here. So to all the queries, this is the one-shot resolution, and that is our site, and that is lpu.in. lpu.in, once you type in this site, this will be the interface that will be coming in front of you. Okay, before I move on to admission queries, I would want you to I would want you to explore a little about our webinars page as well. So once you go to the site, you click on the admissions here, and once you click on admissions, this at the left hand side, you see this LPU's Edufair webinar page. Okay, wait. Yeah, here, LPU's Edufair webinar page. So once you click on this page, there are a whole lot of webinars that are already planned for the coming days, and already so many webinars have already happened in the past. So you can just watch these webinars and register for the upcoming webinars. You can see the enlisted here. So you can register it here, right? I mean, it is all free and you can gain as much as knowledge as you want. So you can do that here. Okay, now moving back to the questions about the admission. So simply go to this admission here. And once you go to this admission, you can see a whole lot of segregated programs that are very beautifully adjusted here. You can see after 12th, after graduation, after postgrad, 10th, diploma, doctoral, etc., etc. So I am just, let's say, taking an example of you are a 12th passed out student and has done your regular program and wants to take an undergraduate program, basically. So you just simply go to after 12th and a regular program. So once you click on the regular program, there will be a whole lot of disciplines that you can see. So whichever discipline you would want to go with, you can just choose that discipline. So you can see in here different disciplines. You name any of the discipline, we have it here. I mean, fine arts, microbiology, physical science, education, psychology, political science. You name any of the discipline, we have it here. Since we were talking a lot about physiotherapy, so just I would like to just click on this discipline. So once I click on this discipline, or any discipline for that matter, so the programs that are offered under that particular discipline would be visible to you on the screen once you click on any particular discipline. Now once I click on this part, as in this program, so I will be clicking on the program, and you can see once I click on the program, there are whole lot of information that you can seek. Right now, in next 1 minute, I'll be briefing them all. So this program details, you can see this highlighted blue part. This program details actually gives you the eligibility criteria, whether you're eligible for a particular course or not. So here you can see that you have to have at least 60% aggregate marks in your 10+2, and English, physics, chemistry, and biology should have been your subject. Okay, and with that, you need to either qualify LPU NEST test or NEET test or CUET test. I mean, this all depends on which test you want to qualify. Now here I would want to mention one thing. This LPU NEST test is from our university, okay, and it not only gives you the eligibility but also the scholarship. So in just next a few moments, we will be learning what scholarship and how we can avail the scholarship from this particular test. Now there are certain other requirements also, so I would want attendees to kindly explore. If you want to have relaxation in your eligibility, you can just check in here. Okay, now moving to the highlight part. So this highlight part basically gives you all the researches that sir has already mentioned in the PPT as well, and all the student achievements that sir has given a beautiful insight of, and all the rankings that university has in context with the course and the discipline, you can see in here. Now going to the curriculum part, this gives you, basically, this is very interesting to note that this gives you all the topics you will be learning in your 3, 4, 5 years a course, right? And you know that this topic you will be learning in this term, and I think that would help you to make a disciplined decision, as you already know that this is going to be taught to you, right? This is you're going to be learning. So I mean, you can easily decide whether you want to proceed with the course or not. Now, moving to the fee structure, the most important part. So our fee is 80,000 per semester. Okay, but again, that one thing that I was mentioning is most of our students don't pay this fee because they get a lot of scholarship, and you can see here you can avail up to 48% of the program fee waiver. That is 48% scholarship on your program fee, and your fee can be reduced to 41,600 per semester. But you need to have in your scholarship in category 1. So basically we have 3 categories of the scholarship: category 1, 2 and 3, and this category 1 is decided on LPU nest test. So the test that you would give for the eligibility would also provide you the scholarship. Now is the thing that how much marks should you score to avail any of the category of the scholarship. So you simply click on this blue hyperlink. So once you click on the blue hyperlink, this is the tentative cutoffs that is visible, I think, in front of you. So you can check for category 1 cutoffs, it is 330 marks, and for category 2 it is 210, and category 3 is 130. So basically these are tentative, right? Like you can assume it as 5 down or 5 up. So at least you should aim to 340 out of 400, so that you can avail category 1 cutoff and hence get 48% scholarship, and similarly for category 2 and 3 respectively as well. So I hope this is clear. Okay, so we also provide scholarship on the basis of your 12th grade. How much grade do you score in 12th? It does also give you a benefit in terms of scholarship in your program fee. You can check it here. Okay, now, for example, you were not able to get any of those scholarships, so do not be sad. We have other scholarships as well on the basis of NEET and financial aid. I mean, LPU does provide financial aid to the students. And if you have been a part of any of the sports, cultural, R&D, co-curricular, social service, bravery awards, or if you are a topper from an education board, or if you have been a part of any entrepreneur or startup or innovation program, so you can avail the scholarship. So basically I would want you to explore these scholarships as well and apply in which you want to and in which you're eligible to. Now is the final part of this session, and that is the important date of the admission, and that is 25th June 2023. So it is not too far now, and hence I would be urging you, requesting you to kindly apply for the test and the course so that you can avail your favorite course and you can get your favorite seat. Now how you can apply is simply click on this apply now option, and once you click on the apply now option, there are these bare minimum requirements that will be asked, and after that you click on the submit, and once you click on the submit, you'll be given your dashboard, and from there you can actually apply for the course and the test. Now I hope that I've given you a brief as to how you can take admission and what all, I mean, all the mini requirements that you might be wanting about a course. But if I could not address anything in the webinar, you can simply write in the Q&A box or chat box, or you can simply schedule a call with us, or you can WhatsApp us, or have a live video counseling session as well. So this side, our counselors will be here to provide their assistance, and you can put up your queries and we will be resolving them. Now, last but not the least are the numbers I will be showing. You can take a screenshot of it or maybe write it down somewhere. You can call on them, and our counselors will be here to give you all the assistance related to your queries about the admissions. So with this, I think I hope that I have given you a brief as where you can go and what all you need to do in order to take admission, in order to apply for a course. And I think if you have any query, you can post in Q&A box. And if not, then I would like to take permission from our expert here. Zaki sir, can I wrap this webinar now? Sir, you're mute, sir. I'm very sorry. You're mute, sir. Okay. Okay, sir. Okay. Thank you so much, sir, for coming in again. Thank you. And thank you so much for, I mean, not just coming in, for giving away navigation through this basically course, this physiotherapy and the profession, of course. And a special vote of thanks for the way that you've explained the presentation. Thank you, sir.
Thank you. Thank you very much.
And a last thank you to the participants, of course, who has come in, who has joined in and waited for this long hour. And the questions that you've given us are really appreciated. So with this, I take your leave. And before I just shut this webinar, I would want you to explore the site that is lpu.in and call us and start applying for the courses. And until next webinar, stay safe and stay healthy. And last, thank you so much for joining in.